The people who serve our military are so important to our nation, and I think that this program is so important to them because less than 1% of our population serves, and they serve all around the world, and yet they come back, and do they have an opportunity to apply those skills here and help us solve some of our most pressing problems, which include serving those who are medically underserved. And the fact is that this program really addresses that issue, and so we're very excited about that. The underserved here in North Carolina really need the best and the brightest, the ones who have the capacity, judgment, experience to be able to make the best decisions. And frankly, those are our veterans. They've been in those situations before. They've had to do this in much more challenging circumstances. I think they will really serve our people well, and we know that the people of North Carolina are very proud of our connection with the military and will embrace them. Well, the history of the program is very important to the history of the university. We were founded by people who fought in the Revolutionary War as an institution. Over the years, as a public university, we've been very supportive of the military, particularly during World War II, but also during the Vietnam War. I think this is our nation's longest war that we're currently fighting in. The world is still a very dangerous place. It's one of our principal roles as a public university is to have this partnership with the military. So I think it's very important we remember that history, remember those connections, and then use those to serve the people of the state. Well, the value for the veterans to become part of this program and to have this additional physician assistant training is it expands on the very specific training they had before they entered into the battlefield or the particular area that they served in. And also it teaches and educates them about the population that they're going to serve and under the rules and guidelines that they're going to need to follow. It really creates a partnership. So we'll learn from them and they'll learn from us and we'll all benefit. Well, the PA alums will be representatives of what really the university has to offer, the state and the nation, and particularly those who are veterans. And it will serve to enhance the reputation of the university that we serve all of the people. And I think all of the missions of the institution will be served by the PA alums, in addition to the wonderful care they will provide our citizens. Well, the reason that the PA program at UNC is in such high demand is because this is such a wonderful university. It has an outstanding reputation. It's a leader in healthcare, not just in North Carolina, but throughout the nation. And also, we have a very close relationship with the people, in particular members of the military. I think that they're very excited about having affiliation with the university and being able to carry that degree and then use both experiences to really do their jobs well. I think it really goes back to the people of the state supporting the institution and having such a quality reputation and being a public university. So the reason to have a physician assistance program is because the time it takes to complete the program and what physician assistants are able to do. The healthcare workforce is changing rapidly in the United States. And we need to have an evolution in the model that we've had over the years. And the Physician's Assistance Program is one of the best ones that's evolved recently. It's extremely flexible, and there are a lot of options for people to graduate. In addition, we would like to expand partnerships with the nursing school, the nurse practitioners, and then eventually develop into residencies so that we can serve the full spectrum of needs for all the people of the state. I think the one aspect that everyone agrees on is that we don't have enough people in healthcare to serve the people who are in need. So the non-traditional student is important for the physician assistant program because we know that there are certain populations, like the non-traditional patients, that aren't being served. But it's also important that the traditional students also be a part of the PA program. We want to have people be able to work together and be able to solve these problems together, whether it's a research institution or a community practice. And so I think the key is that we create an environment where everyone is served. the fact is that it's going to be increasingly more difficult to solve the healthcare problem in our state and across the nation. We have to be innovative, and we have to think differently, and we have to create opportunities for everyone. And the non-traditional student, but particularly the veteran, really represents a great opportunity for us to do that quickly. There's a way to think about the PA program and what we're trying to address as being two tracks, but in fact they come together. And the reason is that people who have been in the military who have served, usually it's in austere environments, and they like solving problems with limited resources. They like being in charge and leading, but they also understand the need for hierarchy and structure. So this is their home, this is where they like to be. So they would be at home in these environments where people really need a lot of help, but they also like to have that sort of structure that allows them to then refer patients, say, back to UNC or some other tertiary care medical center. So this is why the military veteran, the 18 Delta, the medic, is such a great population for us to start the PA program with, because they help us address both issues, allowing the military to have jobs in the civilian community as well as going out to places where we need people to work the most, as opposed to going to an urban environment where we have a lot of physicians, we have a lot of healthcare providers, and the need may not be as great. It's a perfect match. The history of the creation of the PA program relates to the history of the university and its relationship with the military overall. And what that means is that as a public university, we're here to serve all populations. So while the PA program's initiative was driven by supporting members of the military and serving their needs, as well as addressing the underserved, this is first and foremost a UNC program. And so it needs to meet the needs of the university system. And those will always be the primary considerations. But the value of working with the military is that we benefit from our partnership together. And I think that's true not just with the PA program, but many programs here at UNC. My goals ultimately for the PA program is for this to be, as the rest of the UNC system is, to be the greatest public university PA program in the nation, if not the greatest PA program in the nation. But what does that mean? It means that we are selecting the best and the brightest, and we're learning from our colleagues in the military, and then we are creating a network of providers who then allow us to serve the people of the state first, but also become a model for other states to address similar problems and to support veterans. And then we'll be able to investigate, well, why that is. What are the practices that really work the best? What are some of the educational philosophies that the military uses to train their soldiers and medics that we might be able to adapt here at Carolina? And are there any things that we do that they might be able to use while they're training medics? And so I think my goal would be to see the program continue to grow and expand. The number of people who've applied shows that there's great interest. If you look across the state and you see the need, there's absolutely every reason to see the program grow and expand and be relevant. And so I think that's perhaps the most important goal I have, is to just see it thrive. Courses that the students will be taking is through an accredited PA program. So there's a curriculum that's defined by the accrediting agency, but we'll have some flexibility to adapt to various advanced courses in surgery and medicine and situational medicine, as we call it, for additional opportunities. But we want people to be able to have an accredited degree so that they can work anywhere in the nation. North Carolina will benefit from this program because of a recognition that two of our greatest institutions, the United States military, the Special Operations Command, and the University of North Carolina, are working together to solve the problems of our nation here, as opposed to around the world. We are already everywhere else trying to help people get better. It's time for us to make that investment here in North Carolina, and I think that the opportunity is vast. Why? Because many people who volunteer come from North Carolina, but many who serve stay in North Carolina, spend the rest of their lives here, raise their families here. And so this creates an enormous opportunity for us to prove that point. And I think that the people of the state will be extremely proud of that, and then will want to continue to invest in the university and help us expand our programs. I think it's a win-win-win for everyone involved. A million North Carolinians are underserved in a population of nearly 10 million, and they're mostly in rural areas. And when people get trained and they get advanced degrees, they want to work in environments that are comfortable. The military medic is comfortable in those austere environments. That's where they live, that's where they're from, that's where they're comfortable. It's a perfect solution, or a perfect way to try to address a really difficult problem in our state. And we know, because we've heard from the people of the state, that they will love and accept and embrace these graduates.